Welcome everyone to the first webinar in the Pan-Pacific Safe Communities Network series for 2019. My name is Tracy Earle, and together with my colleague Tanya Peters, we are your hosts for this webinar. Before we start the webinar, just a few housekeeping matters. We will have time for questions at the end, and we really encourage it to be interactive, so please participate. Each participant should have access to the GoToWebinar control panel on your screen. If you can familiarise yourself with its features, that'd be great. If you're having any problems, please send a message via the control panel and we will endeavour to sort the issue out for you. If you would like to ask a question during the presentation, please type your question in the question area on the control panel on your screen, or you can put your hand up. To do this, click the yellow hand on your control panel, and at the end of the presentation, we will address the questions. If for some reason your question isn't answered, Zoe, our presenter, will provide an email address at the end of her presentation for you to correspond with her personally. And also just to let you know, this webinar will be recorded and available for viewing early next week. So without further ado, I would like to introduce Zoe Kavanagh, who is our sole presenter for today. Zoe's the Safe Communities Coordinator for Palmerston North. She works in the Community Development Team at the Palmerston North City Council. This involves working with community groups to enable them to work towards collective safety goals. And a part of that is working with the Palmerston North Safety Advisory Board, which acts as the governance group for the Palmerston North Safe Community. This safe community is currently undergoing the reaccreditation process. So following the Safe Communities restructure about 2 years ago, Zoe led a Safe Community priority setting workshop, which was designed to enable a variety of voices to come together in community consensus. And today she's delighted to share with us what this process was like, and she hopes to leave you with some ideas to take away for collaboration potential in your own community. So I'd now like to invite Zoe to start her presentation.
Just double checking you can hear me?
All good, Zoe.
Great, thank you. So, kia ora koutou, Zoe Kavanagh ho. Greetings everyone, my name is Zoe Kavanagh, and as Tracy said,
Muted.
The Safe Communities Coordinator with Palmerston North City Council. And I'm delighted to share with you a little bit about our priority setting process. Happy to answer any questions at the end as well. So I'll just jump right in. So,
Unmuted.
Some of the context, there you go. We did have a change in personnel, both in our governance roles, but also in coordination. Despite my my Kiwi accent, I'm originally Canadian, so I came here about 2 years ago. And with that change in my role as coordinator and in some of the governance, we thought it was kind of time for a change, and added on to that, there was a new strategic direction from the backbone agency, which is the Palmerston North City Council. The council underwent a change in strategic direction and goals and vision and mission, as well as strategic plans, which of course included the Safe Community Plan. So all of those things together, plus it was about 4 years since our accreditation. It was really just a time to reset our priorities, to build some momentum, to reinvigorate some of the groups that were involved with us. And we thought we'd open it up and make sure we were all on the same page. And to do that, we needed new priorities, or maybe not new priorities, but at least kind of an agreed upon set of priorities that we were all working towards, and that kind of seemed refreshed. Important to note that this process that we followed wasn't something that kind of came out of the blue. There's links there to the Parachute Canada and the Australian Safe Communities Foundation websites. They have pretty in-depth and detailed documented processes for how to do a process like this. We followed it somewhat, pretty close, but not identically. It was definitely a really great starting point, and it was it was pretty easy to do and pretty easy to plan because a lot of the hard work was done for us. If that's not enough information, I'm also very happy to share our summary report, which gets into kind of some of the, okay, what do we do now about this, now that we've done the process. So that's just some resources if you're looking for something else. These bullet points here are taken basically exactly from those documents, and it's the why we liked this. And this is what was drawn to me. I was drawn to the process because of these reasons. Given the context that we had a lot of change, we liked this priority setting process because it was grounded in real information about injuries in the community. You'll see that there is a quantitative analysis segment, so kind of using the real stats and the real evidence. It's designed to accommodate a wide variety of viewpoints and opinions on the community's injury issues. So it's not every day that we're all able to look at it holistically and look at our community safety as one big pot. So it was a really great way to look at it that way. It was designed to create a documented consensus. I think that was a big one for me. I really wanted, if we were going to come together and talk about our priorities, I really wanted that to be documented and kind of able to move on from that. We weren't looking for something that would kind of take a lot of meetings in a lot of time. It cannot be hijacked by any special or political interest. That one was there. We weren't too worried about that, but it's good anyway. It enables all participants to emerge with a comprehensive and grounded overview of their community's injury profile. It was really interesting. We really liked that because it was some people who were really focused on road safety normally, they were able to learn a lot about the different injury categories that were happening and things to look out for and the scope and extent of the different community safety initiatives in the city. So that was really good. And it can be completed in 4 hours. So it doesn't take a lot of time, or it didn't take us a lot of time. There is, of course, a lot more planning involved than the 4 hours, but for the stakeholders that you're inviting to join the conversation about priorities, it doesn't take too much time. So that's kind of together with the context of all of the changes, when we found these documents that recommended this priority setting exercise from other safe communities, we thought, you know what, let's give it a try. So we did, and this is how it went. So this is kind of a summary of what we did. It was a facilitated discussion. I said earlier that we wanted it to be really focused and we wanted to get something out of it. And what we wanted were our priorities. And I think that that's really important. There is a difference, of course, between targeted interventions and priorities, but you need to set those really strong priorities before you're able to look at the targeted interventions and what will be effective. So that was an interesting distinction, to be really clear that this process was just setting priorities and not looking at kind of the evidence-based for interventions, but certainly is kind of the framework for that. It was qualitative and quantitative, which I think is important because it's good that people have both the understanding of the data, but also the story behind the data and the background and what we know is happening, but maybe isn't documented, or maybe there are data gaps. So we were able to facilitate those discussions. It was a community consensus. It was kind of everyone's voice mattered in the room, and made to be built upon. Of course, as I said, this was just setting the priorities, and the process is made to set the foundation of all of the work that is to come with the actual safety promotion. So just some pictures of the day. And I'll just kind of go through what we did. So we started the day with karakia and a welcome into the process. We thought it was important to set that tone. This was followed by looking at the data for public hospital injury discharges and fatalities in Palmerston North. The groups were set up into different tables. The tables were roughly designed to give a good broad knowledge base for each table to be able to discuss. So each of those groups discussed what was surprising about the data that they saw, if it fit with what they knew about our community, and if it was easy to recognize the causes or reasons of the injuries showing in the data. And they had been provided the data in advance, so they were able to do some of that thinking through the data and digesting it, if you will, in advance as well. As a group, we came back together to rank the numbers alone. So this was essentially just looking what are our pure raw numbers, what is causing the most injuries, what is causing the most fatalities, and let's rank them. So that was really the quantitative side. But we did capture the discussion. So one of those pages, the bottom left side there, that's all of the discussions about the quantitative data. So people were really, really engaging with it, with the data, which was really great. And they had a lot to say, and it was really fantastic. The order for that was falls, other, road, self-inflicted, and assault. Those categories were based on what we had kind of agreed with as a governance group on what we thought our big categories would be. And of course, the other category became quite one of the learnings that we probably wouldn't go with again throughout the day. That was basically just lumping all of what wasn't falls, road injuries, self-inflicted, or assaults together. So quantitatively, it is quite a high number, but it was interesting in the qualitative results for that one. After the quantitative section, we took a break before reconvening for a qualitative analysis of the same numbers. So each table, and those tables were rearranged, each table went through and ranked their agreement with a series of statements and discussed any large differences between participants. So you can see here, this is kind of this is the list of the statements that we used, and each of the participants were ranking on whether or not they agreed or disagreed with the statements. The averages for each category were collected and merged, which resulted in a qualitative ranking in road, assault, self-inflicted, falls, and other. So those were different than the quantitative, which I thought was quite important. And those questions are essentially the same questions as what had been recommended in the planning documents. We did change the wording just a little bit, and we did we changed them a little bit, but essentially they're there. I noted at that point that one of the early trends in the qualitative assessment was that the group seemed to agree that each category was best addressed with collaborative approaches by several agencies rather than one agency assuming full responsibility, which was one of the questions, which was good and a good sign. So we concluded by combining the qualitative and quantitative rankings to give us a combined priority order, which was, as you can see here, road safety is the top priority, followed by falls. And interestingly enough, the three others ended up with a tie, which was pretty surprising and maybe not what I had, what we had hoped for. It kind of makes it difficult. And of course, there's lots of work to be done in why that happened. But with the further analysis from the conversations and the qualitative assessments, we're able to understand some of that richness in the information that's not captured just by this data and just by this chart. But essentially, we walked out of that day with these priorities, so that was exciting. We closed the day with an invitation for all to continue the engagement in the Safe Community Network, and a description and a kind of a discussion about some of the trends that we saw that might not have been reflected in some of the data. A big one there was the use of alcohol harm and how it might be invisible in the statistics, but it could have been a contributing factor to all the categories, and reducing alcohol-related harm could see a decrease across all the injuries. And there were different trends that came out in the discussion that I think were really important while setting priorities. They weren't available in the data, but we were able to understand that through the conversations and through the process. So it was really quite positive. Of course, we thanked everyone for coming, and we encouraged them to keep active in the community, and then ended the afternoon in Kalakia to close the process, which was a really important day for our community. So we were really pleased with how it came out. There were quite a few interesting byproducts of that day. I was really pleased that feedback was positive. We got them to do kind of an assessment on whether they liked the process and whether they thought the process was valid. And for the most part, everyone agreed quite strongly that it was, and that they were quite pleased. As I alluded to earlier, one of the recommendations was that other category. It was kind of quite large, and it entailed quite a few, too many things to really be given justice. So that was one thing we learned. We were definitely pleasantly surprised with the level of engagement and the level of interest that everyone had. People were really, really enthused about the data, and enthused about talking about it, and enthused about working together to kind of move these priorities forward and see some real movement. As I said, it was just, we tried this out. We weren't sure about it. Having done it now once, I would definitely do it again, and I would, I think every couple of years, every 4 years or less even, it would be really, really positive and really important to do something like this again, because of the reasons that it's quite structured, and it goes quite well and flows quite well, and gives everyone a chance to engage with the data, but also look at kind of their own knowledge and their own understanding. Unexpected results. I kind of touched on this already, but in the qualitative assessment, there was a very, very strong recommitment to working collaboratively as being a priority. Almost everyone strongly agreed that there was no single agency that would be able to solve any of those issues. And that was, it's really encouraging for the model. I think the safe community model in general, that was the tone in the room, and those were the results we got. So that was really good. Maybe I shouldn't have said that was an unexpected result, because I guess I hoped that would be the result, but it maybe wasn't something that I realized that I expected to be coming across as strongly as it did. And then the unexpected result as well was, as I mentioned, something like alcohol pointing to similar root causes, or the causation of those injuries, because that's not something that we touched on too much, was causation. And mental health, of course, could be another one that was discussed. And there was quite a few others as well, which I'm sure we're familiar with. Just on the side as well, we put up a word cloud creator that was kind of in the backdrop of us for the day, asking what was required for the foundation of a safe community. And you can see the responses there. So quite interesting, quite engaging, and it was really encouraging that people seemed to really be on board with the principles of the safe community model. And so that was really good. So what's next? Of course, setting priorities is really only the beginning. It's exciting that we've done that, but there's a lot to do. One of the important points is that priorities don't have the causation, and so if you're looking at something like falls, being our second priority. The way that you're going to be doing any targeted interventions, of course, you would need to know what demographic is falling and how they're doing it and where they're doing it. None of that was brought up. So you could almost run a priority setting exercise for each of your priorities, as each one will have kind of different segments that are more important. So that's one thing that we're doing now. We're just completing kind of big reviews, really specific, what is going to be the most effective interventions and the best strategies to use for each of our priorities. But it's really great that we kind of have an order to start with, and an order of priorities. So now we know where to focus ourselves. So that's really good. And then link with existing networks. I mean, of course, road safety as an example, there was pre-existing groups looking at road safety to make sure that we're connected in with them and that they understand that this is now our number one priority. So let's work together with some of the groups that are already doing that and kind of encourage them. It's not to say that there wasn't people who were interested in road safety at the priority setting exercise, but just to make sure that didn't get lost, that we weren't trying to do it alone just because these were our priorities. So yeah, lots of work to be done. Suggestions for you if you're interested in running something like this. I guess my main one is just do it. It was really great. It was a really great day. We got a lot of really positive feedback. Yeah, I guess more to that. Be open to a new process. So something maybe a little bit different than you're used to doing, or maybe not. It can't hurt. Don't rush the process. It took a lot of time to make sure everyone in the governance and everyone in the leadership understood what was happening on the day and what to take out of it. I think sometimes we want to jump into let's develop our strategic plan and before we've really understood what our priorities are, or let's kind of move down the line before we're able to do one thing. So take your time and send your invitations early and make sure you have those key people in the room. Don't try and rush it. Build relationships with organizations. So I guess that's, again, kind of at the heart of the Safe Communities model, is working collaboratively. We had a really good turnout in the room. I think, if we do it again in a year or two, we'd have an even bigger turnout just because I feel a bit more confident and we feel, that this process works and that it's valuable, and, we can even push it a bit more. But now that you've had me as the guinea pig, I can say that it works really well. So you can feel free to build those relationships and make the invitations open to kind of a large and wide set of organizations. Be clear on project plan and invite list. So yeah, that was really important. The invite list, we basically hit the key organizations, of course, in our governance group, but also some of the main ones that are doing a lot of community safety programming, and kind of our important stakeholders. But yeah, you could definitely even open that up for future iterations of this, and use even more data. So yeah, we only used the public hospital injury discharge data, the publicly available data, which we had made that choice because we wanted it to just be very easy to keep doing and easy for everyone to access the information and even engage with it after the fact and kind of use it as a bit of an information tool. If that was one of the negative comments or kind of some of the critical criticism was that the other category didn't really, it was a bit too broad, so it was kind of difficult to do an assessment on that one. So yeah, you could even separate into more categories that are more specific to your community, and yeah, use those categories a bit differently. But yeah, essentially, and if you have any other questions, I'm more than happy to answer those and look at kind of what suggestions might work for you, and just like make it work for you. It's going to be different for every community, so that's totally fine. And that's basically it. Yeah, that was sharing our priority setting exercise and our priority setting process. So if there's any questions, I'm happy. And otherwise, thank you so much for listening. And like I say, if you ever want to be in contact, feel free.
Thank you, Zoe. That's congratulations on a very successful event, and thank you for your sharing today. It's certainly given people plenty of practical tips to take on board and to model future priority setting on. Are there any questions? If anybody has got any questions, could you put your hand up on the on your control panel, and we'll endeavour to take that question. No? Okay, well, we won't keep anybody any longer, but of course, if you do have any questions, Zoe has said she's more than willing to answer them if you'd like to contact her, or you can send questions to Tanya or myself, and we'll be happy to pass them on to Zoe. So, Zoe, on behalf of all participants, I'd really like to thank you for taking the time to share with us today, and wish you well for your future activity that's led out of your priority setting. A couple of reminders for the attendees before we finish. Could you please fill out the survey on this webinar when this webinar finishes? We'd really appreciate that. And just a reminder that the recorded webinar link will be sent out to all participants next week. It'll be available through both the Australian and the New Zealand Safe Communities websites next week. Thank you everyone for your time today, and I hope you learned something today. Thank you.
Kia ora, everyone. Thank you.